to empowering families as advocates and partners in improving education, health, mental health, and outcomes for infants, toddlers, and children, and as well as youth. I'm the director of the Family to Family Health Information Resource Center, and the Family to Family Health Information Resource Centers are uniquely able to assist families because we're staffed by family members who are experienced and trained in navigating the complex healthcare system. So today's webinar is really designed to answer questions that parents, caregivers, and professionals may have as approaching the topic of surveillance and screening with young children. At this time, I'm going to turn it over to Deepa Srinivarsavardhan, who will be the moderator for today's webinar.
Thank you, Mercedes, and welcome everyone again to this webinar, Developmental Surveillance and Screening, an overview for parents and caregivers. I'm extremely honored, and it's my pleasure to introduce Dr. Manuel Jimenez, who is an assistant professor of pediatrics and family medicine and community health. He's also the director of developmental and behavioral pediatrics education at the Boggs Center on Developmental Disabilities at Rutgers Robert Wood Johnson Medical School. He is an attending developmental and behavioral pediatrician at Children's Specialized Hospital, and his research has focused on understanding the relationship between early adversity and child development, improving access to developmental services and therapies for young children, and promoting shared decision-making in pediatrics. Our next presenter is Jeanette Mejias. She is the Director of Special Education Volunteer Advocates and Family Integration Specialist with the Family to Family Health Information Center at SPAN Parent Advocacy Network. She has served as a medical home parent partner, providing pediatricians with direct support on best practices to establish meaningful partnerships and creating support groups for diverse immigrant families. She also helps identify and create awareness about state and community-based resources to ensure that families of children with autism and other special needs are accessing and connected to these vital supports. She's a proud parent of 2 incredible children diagnosed with autism who are experiencing great success due to her involvement and advocacy efforts. Without any further ado, I would be happy to talk about what developmental monitoring and screening is. Just a quick overview. Developmental monitoring is also known as developmental surveillance, and it means observing and noting specific ways a child plays, learns, speaks, acts, and moves every day in an ongoing way. Developmental monitoring often involves tracking a child's development using a checklist of developmental milestones. Developmental screening is a more formal process that uses a validated screening tool at specific ages to determine if a child's development is on track or whether he or she needs to be referred for further evaluation. Today, we will hear the processes involved in both. This 2-part webinar will provide an overview of the benefits and process of developmental monitoring and screening to educate and empower parents, caregivers, and community partners interested in supporting the healthy development of young children. Today's learning objectives for our webinar are define and describe the purpose, process, and development benefits of developmental monitoring and screening, explain how tools are administered in collaboration with families for screening, describe how to use screening results to plan next steps and connect to resources and services. And we'll also hear a parent leader testimonial of the benefits of screening and navigating developmental concerns within the medical home and getting help. And without any further ado, I would like to turn it over to Dr. Manuel Jimenez.
Thank you so much, Deepa. And so as Deepa mentioned, the goal of my presentation, at least, is to provide some insight into what's occurring in the pediatrician's office around developmental surveillance and screening. And so I'll use the word developmental surveillance to describe the process, as Deepa had pointed out, as monitoring, although they often are interchangeable or used interchangeably. And so we'll spend the first few minutes discussing what exactly the pediatrician is doing from a surveillance and screening standpoint. And then we'll also discuss what these results mean. And then perhaps most importantly, provide some tips in communicating with their pediatrician about child development. And ultimately, the goal of today is to really help to provide or help to empower parents to really feel to engage in the process of surveillance and screening. Next slide, please. So the American Academy of Pediatrics defines developmental surveillance as a flexible, longitudinal, continuous, and cumulative process where a knowledgeable healthcare professional identifies children who may have developmental concerns. And the way that is done is really through eliciting and both eliciting and attending to parents' concerns, maintaining a comprehensive developmental history, and making informed, accurate observations in the office, as well as identifying potential risk and protective factors and documenting the process along the way. And so when pediatricians are engaging in this process, it really should begin with engaging parents to understand their perspectives on their child's development and any concerns that they may have. And so it's important to raise those concerns if they're present. Next slide, please. Developmental screening is the use of a validated structured tool at designated intervals to help identify children with developmental delay. And now it's important to point out that one is not meant to replace the other. The best is when developmental surveillance is occurring at every visit, and then a professional is using a developmental screening tool to help almost serve as a stopgap. So if through the process of surveillance a concern isn't elicited, using a structured developmental screening tool to help identify kids who may be at risk who haven't been identified yet. And there's broadly two categories that we'll discuss today, at least, of screening or developmental screening: general developmental screening and autism-specific screening. And so we'll talk a little bit more about those two types. So the recommendation from the American Academy of Pediatrics is that developmental surveillance should occur at all well visits. And then a general developmental screening tool, and by general developmental screening tool, I mean a tool that's able to detect concerns across different developmental domains, such as communication or socialization. General developmental screening is recommended at the 9-month visit, 18-month visit, as well as a 24 or 30-month visit, or any visit when the concern is identified. Autism-specific screening is recommended at the 18 and 24-month visits, or when the concern is identified similarly. And so we'll take a closer look at what these screening tools look like. And so this is just a visual of what the recommendations are of when screening should occur. And so as you see, in the first 36 months, there should be surveillance occurring at every visit, and then surveillance occurring in combination with screening at the recommended intervals. So this is an example of one general developmental screening tool. This specifically is the survey of well-being of young children, developmental milestones. And so you may see your pediatrician or pediatric professional using this screening tool, or they may use a different one. Other validated screening tools that are widely in use include the Ages and Stages questionnaire, or the ASQ, as well as the PEDS milestones is another validated screening tool. So as you can see, what these tools have in common, though, is that they do help elicit concerns in different developmental domains. And a really neat aspect of developmental screening tools is that they're completed by parents. And so it's really an opportunity to engage the expertise of parents on their children. And so these screening tools ask parents to observe or to provide a frequency of how often they observe different skills in different developmental domains. And so, for example, a gross motor skill such as runs, as well as a communication skill such as names at least 5 familiar objects. Now, one thing that's important to realize about these tools as well is that while we expect the vast majority of kids to have achieved some of these skills by this age, there are some skills here where we wouldn't necessarily expect a child to necessarily have achieved those milestones at 18 months. And so it's important to realize or to recognize the different typical developmental differences that may exist across every child, and based on their uniqueness. But it's also really important to be able to detect kids who, if they haven't achieved certain milestones, fall in the category of developmental risk. Next slide, please. And so this example is an example of an autism-specific screening tool, which is probably one of the most widely used tools, called the MChat. And so since this is an autism-specific screener, the focus is really on aspects of social communication as well as restricted or repetitive patterns of behavior. And so in contrast to the general developmental screening tool, these screening tools, this autism-specific screening tools are really focused on the specific symptoms of autism spectrum disorder. So what do these results mean? And so there's a few really important points to make about how to interpret developmental screening tools. So first, it should always be a collaborative process engaged with a professional. And so parents should engage either if in a healthcare setting, their pediatric professional. If they're in an education setting where an education professional may be screening, it's important to really establish a dialogue to be able to interpret these results and really to understand what they mean. But the first point that I'd like to make is that screening tools are not diagnostic. So what screening tools help us to do is to identify children who may be at risk for developmental delay. And so if a screening tool flags as at risk, that means that a child would benefit from additional evaluation. And so from the perspective of evaluations, it's important to recognize that this is really an opportunity, not only to really identify to what degree delays may fall within a risk category, but also as an opportunity to really understand the child's strengths as well as strategies to best support her or him. And so in communicating with professionals around results, there's a few points that I'd like to make for parents especially. And so I think it's so critical that if you have a concern about your child's development, to really take the opportunity to raise it with the professional who you're working with. Certainly in the healthcare setting, either your pediatrician, nurse practitioner, or other pediatric professional. But it's important that you feel that your concerns have been heard. Importantly, if anything is not clear by the end of the visit, feel empowered to ask questions. This is really an opportunity, again, to engage in a dialogue around your child's development. And also, along those lines, it's really important to understand or to make sure that you know what the next action items are. And so, whether a developmental screening tool falls within the at-risk category, knowing what the next step is that the professional is recommending. And so along those lines, in the healthcare setting, it's really important to be able to identify a contact person in the office who can support you. And so, for example, if your pediatrician makes a referral to early intervention, if for whatever reason you're having trouble making contact with the agency, or a different referral, if you're having trouble making a connection, knowing who in the office you can reach out to, who might be able to who can provide additional support for you. And so in the case of developmental concerns, early intervention is an amazing resource that can be accessed So parents can initiate that process by calling and begin the process of a more comprehensive evaluation. And so I know there's, in this webinar series, there's going to be a lot more on available resources that are freely available. But I've listed just a few here, which are terrific resources. So the CDC has the Learn the Signs Act early materials, which you'll learn a lot more about in upcoming in an upcoming webinar, as well as the American Academy of Pediatrics has really great resources in terms of following along your child's development, and other resources on child health more broadly. Thank you.
Now we'll have our next speaker for today, Jeanette Mejias.
Thank you, Deepa. It's a great honor to be on the call here today and to be able to co-present along with Dr. Manny Jimenez. I am really excited to impart my story about my journey with my children. And for those who are listening, whether you're parents, caregivers, or you're professionals monitoring young children in the child care setting, I just want to let you know that oftentimes when we hear parents' stories, we may see ourselves in that story. It doesn't necessarily mean that that's your story as well. So I don't want you to think that if what I'm sharing might be something that's describing your child. If you do have concerns about your child, what I want to impart with you is to be sure to see a developmental pediatrician or neurologist. So I have two children. I have two boys. One is now going to be 16, actually, and my youngest is actually 11 years old. So what I am going to share is really the story with my oldest son, who was my firstborn. He was 8 pounds 4 ounces, a healthy baby, and I was, first-time mom, and I was in, the clouds, as most mothers are. And my son, according to what I was reading, and at the time I was reading What to Expect When You're Expecting, and they had like a little bit of what you should expect with your child when you have them. And so I felt like I was checking all the boxes for my son at the time, and everything was going really great. When my son turned about 2.5 years old, he started to show some red flags, if you would. He started to lose a little bit of the language he already had at the time. He was not making much sense. He was just doing really odd behaviors that were not really common in typical developing peers. I did address those concerns to my pediatrician at the time, but he didn't seem to be very concerned about him not having all that much language or losing the language. His response merely was, you know what, he's a boy, he'll catch up, don't worry. So I have to tell you, I was a little bit relieved that he didn't see a concern in my son. But as time went on, and I have to say a few months went on, he just started to show more signs that just seemed off. And I'm not a medical professional, but I am a mother, and I felt like I knew my son best, and I just had that like something in my gut, like what's going on? Like something's not right. And I remember distinctively him sitting in front of TV at the time. Blue's Clues was the thing, and I was calling his name, and it appeared he was deaf. He was just not responsive. So I addressed the concerns again, but again, it was just kind of like, not to worry. Before you know it, he's going to start talking sentences. But I didn't really know how that was going to happen because this little boy at one time was able to say mama, dada, juice, milk, now wasn't even saying any of that. And in fact, he started to parrot. So when I would ask him questions to continue to encourage the language, his expressive language, he started to repeat. So an example would be, Christopher, tell me how old you are. And he'll just repeat exactly what I would say. So at this point, fast forward, I actually decided to change my pediatrician and to see someone else to see if they could see my point of view. I actually asked a parent who had a couple of children, been a parent for a lot longer than I was, and she raved about this pediatrician. And I figured if this mother's happy with him and she's a really good mom, then I need to see this pediatrician. I expressed and voiced the same concerns that I did with my previous pediatrician, with this new pediatrician. And he immediately validated my concerns and said, it sounds like he has developmental delays, and I'm not able to really assess him, but I can refer you to a neurologist to see what's going on with him. So, of course, I had to wait a little bit of time. And we know as parents, when we're very concerned about our child, even if you had to wait a day or two, it seems like a lifetime. So I did the worst thing. I Googled, which is not the thing that a parent should be doing when they're suspecting anything with their child. And I was just in a place of worry. So fast forward, I got to my neurologist appointment, and he did receive a diagnosis of autism. I was at first a little shocked, and then I just didn't know what to do because at this point, my son is now 3.5 years old. I lost a year. Um, you know, I started to see the signs when he was a little over 2 years old, and because my doctor couldn't see what I could see, I lost an opportunity for my son to get early intervention. And I distinctively remember the neurologist saying, you're going to have to get him help now through the school because he's aged out. He doesn't qualify for early intervention. And I remember my heart hurting just for that portion alone, thinking, wow, I was trying to be proactive. I was seeing something wasn't right, but the professional I was with didn't see that. And I felt like, wow, if we could have just got on the same page, maybe he could have been helped. But all I could do was just, stay in that present moment and not really revisit because I couldn't change the past. But I know I can change things for my son moving forward. So thankfully, I latched on to SPAN, and I was, connected to a really amazing veteran mother, which is Mercedes Rosa, a parent and also a professional who really guided me, armed me with some really great tools to help me advocate for my son. And I was able to really turn that into something pretty great. So let's talk about a little bit about developmental surveillance or monitoring. Um, Really important. This is something that I myself, was doing parts of it, but, I didn't realize that I could have had perhaps, the grandparents who were watching my son also do the developmental surveillance and really, identify what was going on and what was missing with him. And just understanding that, with the surveillance and monitoring and also developmental screening, both of these platforms are looking for developmental milestones. So it's really important tracking the signs of development and identifying concerns. This wasn't really, I know Dr. Manny had talked a little bit about learn the signs, act early, and we're going to talk a little bit about that as we unfold in the webinar series. But those were tools that I didn't have access to because that wasn't available to me back at the time when I was in my journey. But I'm really excited that it is now. Next slide. Next slide, please. Go back. Okay, great. So in going through my journey, one of the things that I've learned as a parent advocate is that I needed to be the compass, and I needed to learn from the lessons of my journey. And it was a process. I didn't arrive there overnight. It was a process. I started with first, learning and understanding my son first, and understanding what his needs were, and who can be the players uh, to help to help him along in his journey. And so one of the things that I discovered in my journey is there was barriers to screening. One was the assumptions that parents understood normal developmental milestones. So one of the things that I really strongly believe is that instead of being a part of the problem, we should be a part of a solution. We know that this has been a barrier. So what would be the solution for that? To have written resources, share them about healthy developmental milestones. And the Bright Futures booklet, which is through the American Academy of Pediatrics. It's actually national health promotion led by AAP. And it's really a great guideline because it helps families navigate through well visits and screenings. And another thing that we discovered in this, I have discovered in my journey that cultural beliefs and protocols sometimes dictate that you shouldn't question a doctor. I mean, my mother was mortified when I had asked the doctor multiple times. In her mind, it was like, why would you even ask him that? So again, but I was going by my gut, and I wanted to ensure that I was doing what was right for my son. But really, in that regard, we just want to encourage parents, regardless of what your cultural beliefs are, really encourage to really share those concerns before, during, and after your medical home visits, and talk about your culture, especially if it's important to you. And of course, this is really common in the barriers to screening is parental concerns are dismissed and do not result in a prompt developmental screening or an immediate referral to early intervention. That's already my story packaged right there. And it would have cost absolutely nothing for that pediatrician at the time to say, you know what, I don't see what you're talking about, but since you have such a concern, let me give you the 1-800 number for early intervention. Let's see if he qualifies for anything. Would have cost him nothing. But again, in thinking back, he probably was not even informed about that. He probably didn't even know that he had that resource to hand out to families. So one thing that we discovered when families are in this situation, physicians just should be responsive to those concerns and conduct those routine screenings and refer families to early intervention, just like Dr. Manny Jimenez had shared earlier. And lastly, most medical homes, they have limited knowledge, and that's really a barrier of community resources. We have to really be fair to these practices and understand that they can't be all and do all outside of the medical realm. But it'd be great to see some informative posters about milestones and developmental delays, which we find they are rarely displayed in medical offices. So one thing that, we discovered what would be great is for practices to perhaps have a resource corner where they can encourage families to post resources and community activities. Because quite frankly, the parents are the ones who are in the community, and we actually have access more than what the medical practices will have access to. So why not create a community of belonging and strengthening that medical home? And what that happens is you're already fostering that parent-partner relationship where parents are able to call their practice a true medical home, which is really just collaborating together to ensure that there is care coordination. Next slide, please. So we talked a lot about screening and the importance of screening. And although there are barriers and we've discovered a lot of great things, by having these barriers, we also have arrived to a really great roadmap, and it has improved. I mean, New Jersey has really done some great strides in that. I'm really happy to see the progress. So one of the things that we're excited about is that doctors do have and use better tools for early screening. Parents are now more informed about child development, and they have greater access to medical homes and community health centers. They have now resources disposed and accessible to them. There's also a great collaboration and communication between the physicians, parents, and specialists. That has greatly improved. We know that a lot of our children sometimes may have some medical complexities. Now we have from the specialists and physicians and even the schools all talking together at one time, which is really wonderful to see that. Also, the medical home visits have now become more personalized. There's a quality of care that now has improved. I mean, we have the Department of Health who really just recently, within the last year, developed a really great shared plan of care for families to use so that they can have those meaningful conversations with their doctors. It could be documented. Everything is housed in one document, but you keep adding to it. And ultimately, as that child who springboards up to be a young adult will be able to use that as well. Again, that's really improving the quality of care and the standard of the medical home care based on the U.S. Department of Health and Human Services addressing the 6 core outcomes for children with special health care needs. Also, we've made resources available to parents to have direct support and to have guidance. We have a special child health case management unit. There's one in all of our counties. They really serve a very integral part in serving families, especially for those families that have children that land in developmental delays. They can assist them, provide them information, and really help them navigate through different systems, because there's one thing in navigating systems of care through health, but then you're also navigating systems through education. And we also have such really great other initiatives. The quick peak screening, which is not listed here, but is worth making the mention because this is through Children's Specialized Hospital where they're doing developmental monitoring, and all children should go through this developmental screening. And it's not for them to look for a diagnosis, it's just to see if the child is where they're at. And if they're not, they'll revisit the child again, or they'll encourage them to see a developmental pediatrician. We also have a community of care consortium for children with special health care needs. This gives an opportunity for families to come to a forum 4 times a year where they can have their voices at the table. There's an early and continuous screening work group, where if that's of interest to you, if there's something you feel needs to be improved, that would be a work table that you can impart your thoughts and also to learn about some really great tools or anything that's changed. Next slide, please. So here are my boys. This is Christopher and Jacob. They both have been diagnosed on the spectrum. As you know, you've heard Christopher's story. He got diagnosed at 3.5 years old. Jacob got diagnosed a little earlier at the age of 2. Both 2 very different children, but they're absolutely phenomenal. And to really give the testament to Christopher, despite that Christopher did not receive early intervention, I'm grateful that I had tools and I had support through SPAN, through a wonderful medical home. Um, all those things kind of encapsulated together. And my son really has made such great progress. Of course, my little guy is doing phenomenal as well. He benefit from early intervention services, but what was different about that, because we say we never want to compare our children, right? But this, I'm going to have to make a comparison because I want to really convey a message here about the importance of early screening. The older child missed it. And guess what? He's doing great, but it took a village for that to happen. And it took a lot of work. And transition for him was very difficult. A lot of things were difficult for him. He is now in a great place, but it was very difficult to see a little boy from preschool age really struggle in the way he did. Now, his brother, who did receive early intervention, well, guess what? His transition to preschool was seamless. He just, it just all just laid itself out. And there was such a big difference in seeing a child that received those services in the home to transition really smoothly into the school to the child who did not get the services and had to go through the school, which was great. And I'm grateful, but it did take, a lot. It took a lot to get there. So I do want to say, and my message is that early screening is extremely vital. Precious time should never, ever be wasted debating if there's a delay. Instead, families should be connected to supports and early intervention. Referral delays can have a negative impact and compromise positive outcomes garnered with early, effective therapeutic intervention. As I say, we know it takes a village, and we understand that everything matters in the life of our children. So I hope that my story that I imparted with you will give you the courage and not to be fearful of getting your child screened because you're afraid of what's going to come out of it. Don't be afraid. By delaying the process, you're hurting your child more. Sometimes all our children need is just a little bit of early intervention in the home, and they oftentimes don't need anything else after that. So it really just sets them up for success. I want to thank my colleagues for allowing me to share my story, and I'll turn it back over to Deepa. Thank you.
Thank you, Jeanette and Dr. Manny. This has been a great presentation. I can't thank you enough for sharing what developmental monitoring and screening means and what the results could mean for families, and also sharing some important tips for communicating with pediatricians about child development. Thank you both so much for a great, insightful presentation today. I'm going to now turn it over to Mercedes to see if there are any questions for our presenters.
At this time, we're going to open it up for questions or comments that you might have for Dr. Jimenez and for Jeanette Mejias at this time. So I'm not currently seeing any questions in the chat box, but we'll give it some time.
So while we're waiting for the questions to come in, I would like to ask a question to Dr. Manny. Would you please explain if there was any difference between using one tool over the other? For example, you mentioned the SWIC screening tool, and you also talked about the ages and stages questionnaire. Is there a preference for some pediatricians to use one or the other?
Thank you so much for that question. So I think we're still at a stage where we're still learning a lot about the available developmental screening tools and the differences. While it does seem that there may be some differences in the children that are identified with these different tools, the key is that all three perform within at least the three that I mentioned: the SWIC milestones, the ASQ, and the PEDS developmental milestones, all perform at rates that are acceptable in terms of identifying children who are at risk for developmental delays. And so, there's some differences in terms of the way the questions are structured. One big advantage of the SWIC milestones, or a couple of advantages, is the SWIC milestones has a very low literacy burden. It also is publicly available, so it's free. Some of the ASQ and the PEDS milestones, for example, have been around longer, and are quite comprehensive and very good, but they do come with licensing fees that a pediatrician or other provider would have to pay for. And so of those three tools, though, you can feel pretty comfortable that they have been validated, and they are all three useful and acceptable in terms of their use.
Thank you so much for clarifying that. I think that would be helpful for families to know that there are these different screening tools, and eventually all of them are geared towards making sure that the child is developing on target. Thank you so much for your response.
I don't see any questions, but I'll go ahead and ask a question of you, Dr. Manny. We have some providers on the phone, from Early Head Start. What advice would you give them in approaching the subject of screening with families? They work with a variety of cultures. Is there, safe language to use to really approach this conversation in your experience?
Yes, that's such an excellent question. And so, from the professional perspective, we often talk about the utility of using developmental screening tools in terms of, that they're validated tools and that they can really help kids who are at risk for developmental concerns. From a professional perspective, another real advantage of using developmental screening tools, especially when they've been translated and culturally validated in sort of a diverse community, is it can really help to facilitate the conversation around child development. And so for professionals who are using developmental screening tools, they can really use that tool to help open a conversation about a child's development and whatever concerns might be present. I think something that's just so important, though, for professionals to always keep in mind is to really work towards connecting with families and really work towards eliciting whatever concerns that they may have and really attending to them. And so, and of course, there's going to be differences as will be the case in working with diverse communities, but really making sure that we work towards understanding and taking parents' perspectives, and then also being clear in terms of whatever concerns we may have as a professional, I think can really be a way to strengthen the bond between professionals and parents.
Thank you so much for that thoughtful response. And just as a follow-up question, I know you said it was family-centered and questionnaires where families could really provide, their input as the experts who really know their children best. Are these questionnaires available in multiple languages, in that New Jersey and, other states are very diverse in the populations that they serve?
Yes, so that's such an important question to ask, and for professionals, a really important point to really be clear on. So all the tools I mentioned have been translated. To the extent to which they've been culturally adapted varies, though. And so it is something to really keep in mind as you're making a choice about which screening tool to implement in your setting. To really see what is available and to what extent. And all these three tools have information on their websites on this topic. And so I would encourage, as you decide, which tool works, as you're discerning which tool might work best for your setting, to really consider that and to consider the population that you serve.
Wonderful, thank you. So we do have 2 questions in queue. The first one is from Portia Nakado Beleza. With technology being so handy, are there any apps that families can use to promote learning to young children on the spectrum? And then she had a follow-up question. Is Bergen County one of the 21 counties that have special child health services case management unit, and how might we get in touch with them? So perhaps Dr. Manny can take the first one about whether or not there's any apps that can promote learning in young children, and Jeanette can give a little bit more information about special child.
Sure. So it's really a terrific question, and the truth is, in terms of, there's still a lot that we don't fully understand in terms of technology use among children to facilitate learning, and especially for the youngest children. And so, in terms of, so there's no apps that I endorse or recommend. Really, what I encourage families who ask me this question is to really to kind of think about the principles of what we know and to apply it to this circumstance. And so, for what we know in terms of learning, really being able to foster interaction and being able to use something collaboratively with children serves much more benefit as opposed to just passively receiving it. And so by passively receiving it, I mean just watching a video off of an app, or just watching or just playing a video game is quite different than really using it to help to use it together between the parent and the child to help foster the next step in development, or to expose a child to something that they may have not seen otherwise, or to connect with a family member who lives or a loved one who lives a far distance away. And so, all technology use is not equivalent, and I think that's sort of the biggest take home here. And so, again, I think there's a lot we still need to learn in terms of what makes an effective app in terms of promoting child development, particularly for the youngest kids. But those I think are sort of the key principles, and is really thinking about how we're using the technology.
Great, thank you. The next one was for the contact information, so I'll go ahead and answer that. Yes, Bergen County is. I'm just going to post the phone number in the chat, and Jeanette can tell you a little bit more about the services that they provide.
Yeah, sure. So case management, their purpose is to ensure that there's provision of coordinated, comprehensive services for children that have special needs. And really the goal is to assist families identifying and accessing quality health care, or really navigate to the different systems of care. And that way the child can have an opportunity to function at their optimum level. I do have the phone number handy. Did you type it in the chat box already?
No, you can give it. My screen is a little frozen for some reason.
All right. So the number for special child in Bergen is 201-634-2621. They really are fantastic. I actually still work with the case manager within my county with my children. They're just a very invaluable resource. So I'm glad that the question was posed.
Thank you so much. I think you both have done a wonderful job really answering so many questions, and really just providing both parents and professionals with all of the answers that they need to begin inquiring about developmental delays, if there are any, what tools and resources are available, and really how to start, where to really start with those questions, and really in a strength-based way, knowing the language in which to approach their pediatrician, their medical home team as a vital participant and team member of their medical home. So I just want to thank you so much for taking the time to share this vital information with these participants today. And I thank you all for joining today's webinar. If you have any follow-up questions, we will address them in part 2 of the webinar, since the next one really will be about resources and navigating the services around health and education for preschool age children. You can also visit our website, spanadvocacy.org, to peruse through resources and continue navigating for tools and information that might have been shared on today's webinar. So I look forward for you all joining us for part 2 of the webinar, and we thank Jeanette Mejias and Dr. Manny for providing just this wonderful primer that will just support both parents and professionals. So I wish you a wonderful afternoon, and thank you so much for participating on today's webinar.
Thank you.
Thank you.
We will be sharing the PowerPoint via email as well as today's recording. So have a wonderful afternoon, everyone.